Hello doctors, welcome to today's session. Today we are going to discuss about the healthcare delivery system and the role of family physician in the healthcare. So healthcare delivery system simply means how healthcare reaches the people. Maybe the structure, the organizations, and the processes through which the services are delivered. So it includes everything from the community-based care, primary care, to advanced hospital service also. So there are different levels, so each level has specific rules, but they are all connected through an effective referral network. At the center of the system is the family physician, so the doctor who knows the patient best, manages most common conditions, and coordinates the referrals when needed. So, a well functioning system with a strong family physician ensures the continuity of the treatment, the cost effectiveness, and better health outcomes. So, that is about the today's session, and we'll move forward with today's topic. First, we'll discuss about the levels of healthcare system. So, on our healthcare delivery is organized into three levels: primary, secondary, and tertiary level. Primary level, the first point of contact is the sub centers like PHCs and community clinics and family practices. Secondary level is the district hospitals and specialists who handle the referred cases. Tertiary level is advanced referral centers such as the medical colleges and super specialty hospitals. So, patient move upward when they need more specialized services, while the feedbacks and follow up flow back down to the primary care. So, a good system ensures the seamless movement across the levels and guided by the clinical need, not by confusion or any kind of delay. So this is how the healthcare system works. It starts from the primary to secondary, then to the tertiary level. First, we'll see about the primary healthcare. So that is the foundation. So primary healthcare is the foundation of the entire healthcare system. So it focuses on the health promotion, disease prevention, early treatment. Services include in this here is antenatal care, immunization, communicable disease control, and management of the chronic illnesses like hypertension and diabetes. Though, so here the family physicians plays the important role of the primary healthcare. So so that family physician prevents the unnecessary or referrals or ensuring community level health education also. That is how family physician works in the primary healthcare. So when primary care is strong, hospital burden and healthcare cost drop significantly. So that is how it will work. Second is the secondary and tertiary care. Secondary and tertiary care. So the secondary level includes the district or the taluk hospitals with the specialist. So for example, managing deliveries, pneumonia, or any kind of minor surgeries and all. Moving on to the tertiary care, the tertiary level deals with the advanced resources like intensive care, cardiac surgery, neurosurgery, oncology, and if there is any kind of transplantations. So, but all of these depend on the effective referral and feedback from the primary healthcare. So, every referred patient should come with a complete summary diagnosis, vitals, treatment given, and reason for the referral, and after treatment or post treatment. And the tertiary centers must send feedback to the family physician for the follow up care. So, this is how the healthcare levels work from the primary, secondary, tertiary, and from the vice versa. So that is how what about secondary and tertiary care. Next is the referral system. So a referral system connects all the levels of care. It ensures that the patient gets the right service at the right level and at the right time. So if referral slip should clearly mention the diagnosis, the treatment given to the patient, reason for the referrals, and the reason for the urgency. For example, a patient with an uncontrolled diabetic foot infection referred to a surgery. So in such cases, it should include the glucose levels, antibiotic starters, and wound status and all. Similarly, the higher center must send the feedback after the management so that the primary care doctor can continue the follow. So this is like a two, as I've mentioned, this is like a two-way communication which maintains the continuity and prevents any kind of duplication of care. So this is how the referral system works. Next is the role of family physician in the healthcare system. The family physician provides continuous care and personalized care for the individuals and as well as the families. So they manage both the acute and chronic conditions, coordinate with the specialist input, and ensures the preventive, promotive, and the rehabilitative care. So they are like the first contact in the illness. So the coordinator in referral, and they also are like what you can say, like the family physician are like a advocate for the patient. So they also maintain a detailed medical records, ensure the follow up, and often detect the early signs of complications. So in short, family physician is the central link between the patients, specialist, and the community. So that is what the important or the role of family physician. Well, coming to multidisciplinary care, so family physician, multidisciplinary care, healthcare today involves multidisciplines like doctors, nurse, physiotherapist, dietitian, psychologist, and social workers, etc. So the family physician act as the coordinator among all these professions. So they integrate the physical, mental, and social aspect of the health to ensure the patient have a centered, ethical, and a cost effective care. For example, a patient with like in a stroke patient, the family physician coordinates with the neurologist, physiotherapist, dietitian, and monitor the medications, counsels the caregiver, and ensures a long term rehabilitation. So this coordination improves the recovery and reduces the number of hospital readmissions also. So that is the importance of family physician in the multidisciplinary care. Coming to the clinical relevance, so in OPD management, what is the clinical role of family physicians? So most of the family physicians works happen in the OPD setting. So we see patients with a fever, cough, headache, hypertension, diabetes, skin condition, etc. So in OPD approach, it should be like first take a focused history and perform the targeted examination, do essential investigations only, and give an initial treatment with antibiotics for infections, antihypertensives, and hypoglycemics, etc. And educate and as well as counsel the patient about their things, and decide on referral if any kind of red flag signs appears, and also schedule a follow up and document everything the patient says. So the goal is to solve the 80 to 90% of problems at the primary level itself and refer only when it is that necessary. So that is how you can, as a family physician, you have to work in the OPD basis. Well, coming to the IPD management, in the IPD settings, the family physician coordinates with the inpatient care. So they handle the admissions, daily progress notes, and communication with the specialist and the nurses. And also, they ensure proper investigations, monitor the treatment response, and prevent any hospital complications also. So here, the family physician plays a key role in discharge planning, also explaining medications, diet, and warning signs to the patients and as well as their relatives. So they link discharged patients back to the community follow up and the primary care. For example, a patient is admitted for a COPD exacerbation. After stabilization, the family physician arranges a follow up for inhaler technique, smoking cessation, and home oxygen use. So, this is what ensures the continuity between the hospital and home. So, that is about the IPD management. So, to summarize today's lecture regarding the healthcare delivery system and the role of family physician, the healthcare delivery system, as we have discussed, have three structured levels: primary, secondary, and tertiary. Referral systems ensure smooth transfer and feedback between these levels. The family physician plays an important role like a central link, offering continuous coordinated care. In OPD, they manage the common conditions and counsel the patient. In IPD, they coordinate with the multidisciplinary team and ensure a safe discharge and continuity. So, when the system and the family physician work together, the result is very efficient and patient centered healthcare. So this is how what about today's topic. Thank you, doctors. Remember, strong system begin with a strong primary care and a committed family physicians like us. So that's it for today. Thank you for patient listening. Have a nice day.